Welcome, everybody. My name is Ashu Mishra, and this is part two of our series on preparing immigrant health professionals for U.S. employment. This lecture here is titled Employment Pathways in the U.S. Health System, and I'm joined here today with Neil Rafiq, Hosai Todd Hisham, and Gilbert Burnham. This is a collaboration across three organizations: the Afghan Medical Professionals Association of America, Johns Hopkins University, and Upwardly Global. Here in our introduction, I'll cover briefly the goals and contents of the remaining lecture, as well as an introduction to some of our partners in our collaboration. The goal of this lecture is to identify potential employment pathways in different sectors of the U.S. health system. We're here to inspire ideas for employment options in the short term and long term, where some options may be something that you join earlier on while you're working on your way to obtaining longer term employment options. Maybe some options with additional certifications and licenses and so on. The contents of this lecture include the introduction that we're in right now, a provider side employment pathway overview, as well as overviews of the public health sector, biotechnology sector, and payer side of the health system. This recording is a second step in a voluntary program that you can use as a resource for getting employed in the U.S. health system. This program is a collaboration of three organizations: Johns Hopkins University, Upwardly Global, and AMPA, which is the Afghan Medical Professional Association of America. It was designed in response to a growing number of Afghan health professionals relocating to the U.S. after the regime change in 2021, and its overall goal is to help foreign health professionals relocated to the U.S. find employment in the U.S. health system. I want to introduce now one of our partners, Upwardly Global. Upwardly Global is a nonprofit organization that helps job seekers. They train recent immigrants and refugees to use their education in the U.S. workforce. They provide services such as one-on-one job search assistance, access to a virtual learning library, free online certification programs, and exclusive virtual networking events. Upwardly Global also collaborates with 50-plus leading U.S. employers, and their website is listed.
Hi, everyone. This is Dr. Hosai Todd Hisham. I'm the Acting Executive Director for AMPA, Afghan Medical Professionals Association of America. As mentioned, we're a 501c nonprofit organization based here in the United States with the main mission to unite all Afghans healthcare professionals in order to provide medical education, medical assistance to all people in the U.S. and in Afghanistan. And our mission is purely humanitarian without any political agenda. Afghan Medical Professionals Association provides services to the community via various different sources. We mainly focus on telemedicine opportunities to deliver healthcare and coordinate mental health care. We do career counseling for Afghan refugees who have medical backgrounds in order to re-enter the work field. And we also do cultural competency training for medical providers here in the US, as well as providing public health information for refugees for better health and improved quality of life. In this presentation, the overview of the U.S. healthcare system has already been covered from an employment perspective, but mainly we want to make sure that those who are entering the health field have a good background in education in terms of how the healthcare system operates in the U.S., both from a point of view of the patient and what the patient should expect in terms of providers, the technology available for them, the payer system, and including health insurance, and the legal regulations and the laws that protect them and their needs. In addition to the course here, those benefiting from this course can also go into the U.S. Bureau of Labor and Statistics website, where they can find many of the information that we are covering over the slides here.